welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Lowering risk of cancer, respiratory disease and diabetes. Exercise 150 minutes per week. A new questionnaire-based study has suggested that individuals who reported the highest level of physical activity, meaning those who exercised moderately to vigorously at least 150 minutes per week, were at statistically significant lower risk of having 19 chronic conditions including cardiovascular disease, cancer, respiratory disease and diabetes. The findings are published in Preventing Chronic Disease Journal. The findings further suggest patients who are at least active, meaning they reported little to no exercise in a given week, are at increased risk to develop a chronic disease. The Exercise Vital Signs Survey, as the questionnaire is called, asked patients 2 questions that they answered on a tablet. Number 1. On average, how many days per week do you engage in moderate to vigorous exercise? Number 2. On average, how many minutes do you engage in exercise at this level? Study reveals association between herpes simplex virus and Alzheimer's disease. Researchers have uncovered a surprising link between Alzheimer's disease and herpes simplex virus 1, suggesting that viral infections may play a role in the disease. The study results are published in Cell Reports. The study also revealed how tau protein, often viewed as harmful in Alzheimer's, might initially protect the brain from the virus but contribute to brain damage later. Study uncovers how Mediterranean diet improves memory and cognitive performance. In a study published in Gut Microbes Reports, researchers at Tulane University School of Medicine found that subjects following a Mediterranean diet developed distinctly different gut bacteria patterns compared to those eating a typical Western diet. These bacterial changes correlated with better memory and cognitive performance. The study found that rats fed a Mediterranean-style diet rich in olive oil, fish and fiber over 14 weeks showed increases in 4 beneficial types of gut bacteria and decreases in 5 others compared to rats eating a Western diet high in saturated fats. These bacterial changes were linked to improved performance on maze challenges designed to test memory and learning. Specifically, higher levels of bacteria such as Candidatus saccharomonas were associated with better cognitive performance, while increased levels of other bacteria such as Bifidobacterium correlated with poor memory functions. New formula for hyperfiltration and glomerular filtration rate, study finds. Researchers have come up with a new calculation method to accurately assess glomerular filtration rate. The findings were published in Hypertension Research. Annual health checkups regularly include urine tests that serve several purposes, including checking for symptoms of kidney disease. The presence of albumin in the urine is one indicator, as is glomerular filtration rate. In diabetic nephropathy, albuminuria first appears, leading to excessive filtration and eventually a decrease in glomerular filtration rate. In the elderly, however, excessive filtration cannot be detected due to age-related glomerular filtration rate decline. Researchers assessed 180 kidney transplant donor candidates to define a new formula for determining the threshold value for hyperfiltration based on age and glomerular filtration rate values. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.